Can erectile dysfunction be restored? It's important to talk with your urologist because ED can be an alert signal of cardiovascular disease. Treatment options are available that can get back your self-esteem. Talk about your needs and expectations to your doctor. Treatments for ED include lifestyle changes, pills, penile injections, vacuum pumps, and penile implants. Typically, pills must be taken at least 30 minutes before intercourse. Although pills can be a satisfying solution, they do not work for everyone. Another treatment for ED is penile injections, a therapy that requires to give a shot on the penis to get an erection. The penis injection takes 5 to 20 minutes to show results. Vacuum pumps are placed over the penis and manually pump. The pumping pulls blood into the penis, creating an erection. A constrictive ring is placed at the base of the penis to trap the blood and maintain the erection. Penile implants are the last and permanent treatment option for ED. If other treatment options do not give satisfaction or are not well tolerated, it provides a fast erection. It requires a surgical procedure. There are two types of prosthesis available: malleable and inflatable. Coloplast has Genesis, malleable, and Titan Touch, inflatable. In Europe, the most used is inflatable. Talk to your doctor to discuss the most appropriate option for your case.